All right, so we're talking about diets in America. And the next one up is intermittent fasting. So, intermittent fasting, there's a wide spectrum when talk about intermittent fasting. I mean, there's some people that would say, well, you're not actually intermittent fasting unless you're haven't eaten for 24 hours or 36 hours or 72 hours. That's actually intermittent fasting. And then there's plenty of literature that suggests that after 13 hours of not eating any food, we start seeing the benefits related to fasting. So those benefits, as I said, 13 hours is kind of where your starting point if we're talking about intermittent fasting. And then it seems like you can maintain the benefits if you're doing intermittent fasting consistently by going up to about 18 hours, with around maybe 15, 16 hours being kind of the sweet spot where you get loads of benefits and very, very minimal potential side effects or feeling like you can't keep doing it or you're not getting enough nourishment, that kind of thing. So I think one of the coolest things about intermittent fasting is that generally people just end up eating less calories. And in America, in the industrialized world, we tend to eat too many calories as a whole. We're just eating all day long. And intermittent fasting gives us this section of the day where we put all of our calories, all of our food, and then the other section of the day we get to just drink water, sip on coffee, drink tea, and or just hang out and do nothing related to food. So it is a way of kind of freeing us potentially of the bombardment of food choices all around us at all times, which is really, really awesome because we only have a small capacity to make choices all day long and have the willpower to make the choices we want to make. And I was just reading the study showing that there's over 3,000 food choices that we actually have to make. The average person has to make during the day, related to commercials and signs everywhere that we see, and the foods in our refrigerator and what's in our purse, our drawer. All these things that we have so many choices to make all the time related to food that our willpower after like 2 or 3 o'clock in the afternoon is just smashed. And it's no wonder that so many of my patients, they have an amazing breakfast, an amazing lunch, and then for some reason at 4 o'clock, everything just goes to the wayside and they can't figure out why they end up going to McDonald's or why they go into Safeway and grab a bunch of fried chicken, or why they get home and they have a meal already made, but they end up ordering pizza for themselves. The thing is, it's because we have so many decisions to make during the day already. And by the time 4 o'clock comes around, like our willpower is spent. Our ability to make the decision we want to make, that we were hoping we would make, it's gone. And so our body ends up going back and doing the thing that's easiest for it, which is to go for the thing that's going to give it a reward signal, which is going to be floury foods, fried foods, sugary foods, things that get that dopamine just surging. So that's a really, really good thing to consider when we talk about intermittent fasting, is the fact that we get a break. It's kind of nice. We get a break from food for potentially 13 to 16 hours a day. I personally, if you're going to do intermittent fasting, would suggest having your cutoff time be like 7 o'clock at night, 6 or 7 o'clock at night, because a lot of people are like, well, I'm going to wait till like 1 o'clock, 2 o'clock in the afternoon, and then I'll eat till like 8 o'clock at night or 9 o'clock at night. I mean, in a lot of ways, I feel like it's defeating a lot of the purpose of intermittent fasting, because one of the goals of intermittent fasting is to maximize the potential for detoxification, for insulin sensitivity, and for making your sleep this rejuvenating experience. Whereas if we're eating, 9 o'clock, which even for myself, this happens sometimes. So I'm no perfection. I'm not perfect about this either. But if we're regularly eating after 9 o'clock at night or even later, we're making it challenging for our body to do the full rejuvenating, refreshing experience that we want it to do, and we hope it can do. We're lowering the ability of testosterone and human growth hormone to be produced, because our body's focus and pushing so much blood into our intestines and stomach to make sure we can actually digest the food we've eaten. As opposed to if we're intermittent fasting and we stop eating, say at 6, 7 o'clock at night, then our body has all this capacity to push all the nourishment and blood and growth factors to our organ systems, to our brain tissues, to our muscle tissues, our bones, ligaments, tendons, all that, to repair them and refresh them. So come the next day, we're ready to rock again. So I would definitely look at that, and so as opposed to say eating your first meal at 1 o'clock in the afternoon, I would consider 9 or 10 o'clock in the morning, and then shutting it down by 6 o'clock if you can. That would be the optimal, and I think you would find your sleep is better. Your sleep is more restorative, that you feel like your body as a whole is just lighter and fresher on a daily basis. So what could possibly be benefited from doing intermittent fasting? So weight loss is number one. That's by far the biggest deal out there, is weight loss, and I've definitely seen that happen consistently. People that, in fact, some people that couldn't lose weight, or seemingly couldn't lose weight for years, who finally said, I'm gonna do this intermittent fasting thing, and now have lost weight and even have trouble keeping weight on because their appetite is so suppressed, and they just have this window to eat within, and so if anything gets in their way, they weren't able to, say, eat a meal or something, so they only end up eating 2 meals or 1.5 meals during that 6-8 hour time frame, and then they're just so accustomed to not eating at those other times, because it's not a choice anymore. They're just, why just fast during that time? That's how it is. So then we've had some trouble keeping weight on people, which is something to consider. And if you are an athlete and you're trying to gain muscle tissue and you're trying to really perform well, then like an 18 hours of fasting is probably gonna be too much. In fact, 16 hours might be too much. So probably that 13, 14 hour time frame is gonna be optimal. I think most people probably could do 15, 16 hours. It's just you'd have to be really on it to make sure, okay, right when that time hits, hour number 1, you get food in, and then when you get food in again, 2-3 hours later, then you get food in again, another 2-3 hours later, and then boom, you're done. You got your 8 hours of eating, and you're over it. But you're just gonna have to watch yourself, because you definitely can see some decreased recovery and an inability to feel like you're putting on muscle tissue and gaining a performance edge. But at the same time, if you are having that 14-hour window of fasting, 16-hour window of fasting, you're getting these surges of hormones and this sensitization of insulin, and this promotion of better circadian rhythm in your body. So cortisol response is at the right time and not at the night time, which all that helps you in recovering and helps in your ability to grow muscle tissue and lose excess fat and that kind of thing. So there's a trade-off there. It's just long as you get the good nourishing foods in during that 8 hours, enough calories, then intermittent fasting can be spectacular. There's also studies showing that in the intermittent fasting, that having this fasting window can help increase human growth hormone, like I mentioned. Also can lower blood pressure, lower heart rate, lower triglyceride levels, lower the not so helpful cholesterol molecules, and increase the nice fluffy buoyant cholesterol molecules, which is great for heart disease, coronary artery disease, any kind of issues with blood flow in the body, including like plaques in the brain. So anytime we're in a fasted state, we are essentially reviving our tissues. Now, sure, if you go down far enough, we start fasting too long, then we start getting a lot of breakdown of tissues too. But 16 hours, you're just going to get reviving, refreshing of the body without any breakdown, which is fantastic. Now, you don't actually need to do intermittent fasting every single day. You can do it once a week, twice a week, 3 times a week, 10 times a month. And you could still gain benefits and a refreshing from the body, which I think really for most people, that's the best way to do it, is say, okay, twice a week, I'm going to do intermittent fasting. Then you're not going to feel like, every time somebody asks you to go out, you're like, well, I'm just going to come and drink water with you. Or, family things going on, you're always just can't do anything with them. So I think it's best to do it like 2-3 times a week. And then, the rest of the week just open, or, special occasions, you're not intermittent fasting. But if you're going on an airplane ride or something like that, intermittent fasting would be fantastic. It will, would helps the body reset its circadian rhythm, and it's just way less stressful on your system. I talked about ketogenic diet before, but that's also another thing. If you're going through cancer treatment if you're getting radiation therapy today or chemotherapy today, then I would be in ketosis. I would fast during that time frame because that is going to make the therapy so much more effective, and it's going to make your potential side effects so much less. So a state of ketosis or fasting when you go through standard oncology therapies makes for your cells that are healthy being much stronger and able to withstand the negative impact of those toxic elements, and makes those toxic elements much more toxic to the cancer cells themselves. So that's something, that is a way, I should have mentioned that earlier on another ketogenic video, but I do always recommend that, or 99% of the time, though you should talk to your doctor if you're in these situations. A ketogenic diet or just a pure fasting. Like I had a patient who was going in for therapy, and so they fasted 40 hours before getting their particular cancer therapy not too long ago. So it can make a huge difference. And that's probably one of the best places we've seen in medicine as far as the effect of fasting is in people with cancers and stuff, and the ability to decrease the effects of a lot of these medications. I would also consider, if you're going off a medication, antidepressants, anti-anxiety medications, prednisone, corticosteroids, any of these, I would consider talking to your doctor about having a time of fasting. I mean, maybe 1 day, 2 day, 3 day, maybe water and tea, maybe just like bone broth to hasten the quickness that your body comes over and gets out of those, gets rid of those withdrawal symptoms. So strongly consider that. But generally speaking, overall health is massively helped by intermittent fasting, and I would promote it to pretty much anybody. Just if you are an athlete, or you're very lean already, or say you do have cancer or cachexia going on, you have to make sure that you're actually getting enough calories in that window, that window of whole nutrition. So another thing to consider is if you're intermittent fasting versus a ketogenic diet, intermittent fasting, you will probably get into ketosis every single day. It's just you will not be in ketosis all day, which I think is be normal. I think that would be a standard way for the human body to live and thrive. But you could have some berries on an intermittent fasting diet. You could have an apple. You could have some pineapple. You could have a sweet potato. You could have these things that are very nourishing foods. You could have those when you're intermittent fasting, because all you're concerned about is getting awesome food in your diet for 6 to 8 hours a day, and then the other part of the day you're fasting. So that time you're getting food, you're not concerned about what's my macros, what's my fat percentage, all that. All you're concerned about is just getting delicious, nutritious food into your body, which will definitely cause you to accumulate health. All right, so any questions, comments, put them below, and I will be sure to get back to you. Thanks.